City saw its highest number of deaths, and Kansas City has seen an increase in hospitalizations. Those things give us grave concern about our ability to contain the spread with schools being open in any type of normal structure and way. That being said, we also recognize, however, that schools are vital to our society, to how we function, to how children are taken care of and educated. We have no interest in seeing schools delayed significantly. We have no interest in seeing educational opportunities for our children limited. And so with that, we make the following announcements. First, I will note that we'll have a series of recommendations from Kansas City, not mandates. Those recommendations will include the following. In alignment with our peers in the state of Kansas, we're recommending that schools start after Labor Day, no earlier than Tuesday, September 8th. Because that is a recommendation rather than a mandate, we'll leave it to school leadership in our public schools, charter schools, parochial schools, all schools with buildings in Kansas City, Missouri, to do what's best for them and their students, but we would make that recommendation. Our second recommendation is as schools are organizing both their classrooms and their facilities, they recognize that the rate of infection, the risk of infection, increases by age. So that where social distancing is available for things like seniors and juniors in high school, it's better for us to make sure we're using either better social distancing, virtual classroom environments, et cetera. Whereas with younger children, the risk of infection has been found to be lower. And so in those situations, we think a return to regular classroom instruction, or at least as regular as it can be, is something that we can see sooner. I'll also note that we are asking all of our county partners, that would be Platte County, Jackson County, Cass County, and fortunately our friends in Clay County have already provided funding. We're asking our county partners to provide further funding to schools to help facilitate their reopening. In Clay County, for example, millions of dollars have been given to our school districts there, Liberty, North Kansas City, Smithville, among others, to help facilitate the reopening of classrooms, to help ensure that both faculty, staff, and students will be safe upon their return. Kansas City resident children in our other school districts in Cass, Jackson, and Platte County deserve the same opportunities, and they've been asking for support. I ask my county partners to make sure they're helping us with that along the way. We'll say this for you as well. There is no broad plan for us to close school buildings if we can avoid it. What that means is that to the extent we see outbreaks, we would look to identify them as to individuals, as to individual classrooms, and as to individual school buildings. We have no intention, if we can avoid it, to more broadly close all schools in Kansas City, Missouri, as we saw last spring. However, we will note that we are always measuring new infections, hospitalizations, and deaths as a measurement for what it is that is necessary for us going forward. A few other items, and then I'll get out of the way for Dr. Archer. One relates to the fact that youth tournaments and youth sports tournaments have been a topic of much discussion of late. While we understand that everyone needs to go outside, and indeed organized activities are not something that we say are bad in any way, large youth tournaments that have brought together hundreds of competitors have been seen in other parts of Missouri, particularly in St. Louis County, to have spread COVID-19 fairly significantly. And so we're asking those who organize youth tournaments and other larger combination youth activities to hold off from scheduling those until at least after our school start date, or to have smaller interscholastic or inter-team competitions over time. We'll also note that for schools that are interested in in-person instruction, there still is a strong preference for outdoor events, recreation, instruction, rather than indoor spaces being used. As you know, Kansas City's orders relating both to masks and other activities relate to indoor public accommodations. We will continue to note that there is a distinct balance between what we're seeing indoors versus the outdoors. And so even where there are still youth sports practicing, for example, let's say there's a cross-country team that is practicing already, we would encourage those coaches not to have indoor activities on a rainy morning, perhaps like this one, or for crowded facilities like showers and other facilities to be used prior to the start of the school day. We appreciate our relationship with all of our school partners, and that's why we're sharing this information at this time broadly with all of them. This isn't just an issue where we're speaking to one school district or just public schools. We understand that parochial, private schools, charter schools, and public schools are an important part of our educational network in Kansas City. We understand that the health of teachers and our faculty and staff are vital for Kansas City as well. And it is in connection with all of those, including the health of children, faculty, parents, spouses, and so many others, that we make those recommendations today. I'll be followed by Dr. Rex Archer, and then I'll come back for more questions.
Thank you, Mayor. So some of you may remember back in the spring where my concern was that the benefits of education were outweighing the risk of the disease spreading in kids in schools. And so I actually was not supporting closing schools at that time. We closed and did the stay-at-home orders about a week before we saw the first cases here in Kansas City. That overall stay-at-home closure made a huge difference in our first wave. Unfortunately, we still had 16 deaths, but as you can see in our second wave, we are now almost at twice that, and that's continuing to grow. Over the last 10 days of this month versus the first 10 days of this month, we've seen a substantial increase in folks under 19 having this disease. And that's the big concern. We're seeing huge spikes now in the St. Louis area, and we have often followed St. Louis with this disease and this outbreak. So, because of that, every school district needs to assume that they've got virtual capacity to handle education for the kids for this fall, because the chances that individuals, parts of classrooms, entire classrooms, or even potentially an entire building might have to be home because of the outbreak. We also are worried about the transmission of the virus to the faculty, the adults, the teachers, the support staff that are in those schools. At this point in time, the one piece of hope that we have, or really two pieces of hope. One, the wearing of the masks is catching on. More and more people are complying with that. We're hoping that that will slow down the rate of the increase of this disease. The other is that we're seeing most of our transmission to kids coming from adults, family members, not kid-to-kid spread or kid-to-adult spread. So that's part of why we believe that particularly for the younger grade levels, we're much more likely to be successful at keeping them in classroom instruction and protecting everybody than we may have for the high schools. So part of this issue of delaying some of this opening until after Labor Day will give us a better sense on where is the outbreak going. Is it slowing down? Is it actually dropping back again? Or is it continuing to increase at the rate that we've been seeing, because we've seen substantial increase in the last 10 days from the first 10 days.
The only thing I have to add this morning is, as a mother, this is something that's near and dear to my heart. We were talking about our children and masks and going to school, so I appreciate the leadership from the mayor and Dr. Archer this morning on such a tough topic.
So any questions?
Yeah, I have a couple questions for you, Mayor. The first question I have is, what happens if a teacher or student tests positive? How will that be handled?
If a student or teacher tests positive, how will that be handled?
If a student or teacher tests positive? At present, if a student tests positive, I think the protocol would actually be essential for the school district to promulgate. I know the Department of Public Health would certainly ask to be notified, would ask to then have, I imagine, the student go through the usual protocols as relates to being quarantined for us to conduct adequate contact tracing thereafter, and then hopefully we'd be able to contain from there. Indeed, that's kind of, and what we talked about for some time, the importance of contact tracing in connection with these issues, which is that to identify, right, to test, to be able to test everybody who may have been exposed, to then be able to address those concerns, or to allow people to go back to school after they've been found negative in that situation.
In regards to what you just mentioned about contact tracing, how many contact tracers do you have right now? And secondly, what's the policy about masks going to be on the school buses?
So partly following up on the first question, anybody that tests positive has to be isolated. We then have to do an investigation to determine who else has likely been exposed and then needs to be quarantined. In many cases, we may have ill children, and we have children that have illness all the time. There are a lot of children at any day, at any point in a school year, that will have at least one of the COVID symptoms. So we've been working with Children's Mercy to create a flow chart and a matrix to where if a child has 2 or more of the types of symptoms of COVID, then we would be quarantining that individual because we don't know that they have COVID, and try to get them tested and then determine what does the look of spread occur right now. Now, originally we had only 3 staff that we could do contact tracing with. We've added a group of 4. We have a couple of federal assignees, in a sense, through the CDC Foundation that are working with us now. A couple people from the State Health Department. We've been interviewing over 50 different individuals to be bringing on board. I've gone through the first round of interviews and are hoping to get close to offering positions for those folks. So that's the other timing issue here, is that if we have huge outbreaks in schools, we've got to have the staff to manage those outbreaks so that we don't have to overreact. That's a good question.
And then the mask on the bus, what was your policy for that?
So wearing masks is required for all these different kinds of settings and will be required on the buses from our perspective. The issue of how the seating is going to occur, we're working with the school districts about trying to make sure that there's really assigned seating, as an example, on the bus. You know, 2 kids from the same household could sit next to each other because they're already in the same household. But we need to know if there is an outbreak and a positive case on a bus, who else has to be quarantined versus the whole bus having to be quarantined. So all those things, we're meeting with the superintendents and the schools to try to figure out the safest way. Little tricks of the trade. For those of you that have glasses and wear a mask, sometimes your glasses fog over, and there are tricks even with like shaving cream where you can do some things to keep your glasses from fogging over, because obviously we don't want a bus driver to have a mask on and have their glasses fog over and not be able to see. So we're working through huge numbers of details all the time now.
All right.
You just heard from Mayor Quinton Lucas and Dr. Rex Archer, the director of the Kansas City Health Department, out with new guidelines for the return to learning in this school year. So many questions from parents and teachers right now. But because of a rise in cases, especially among younger patients, according to the health director, leaders and health officials are recommending in Kansas City, Missouri, that schools start after Labor Day, much like what we're seeing on the other side of the state line in Kansas. Now, the mayor stressed in his remarks that this is a series of recommendations, not mandates, in the name of health and safety. We've listed a few for you here. He's recommending schools with buildings in KCMO start after Labor Day. Again, also asking all metro counties to help with funding in schools to better pave the way for reopenings, especially in those smaller school districts. The mayor also made a point of saying there's no broad plan to close down the buildings and avoid buildings if that could be avoidable at all. So they still very much want to eventually have kids in classrooms. Mayor is asking organizers of youth sports tournaments and activities in and around the metro to hold off until after school starts, or he said have smaller competitions, maybe members on the same team playing over time. He is also encouraging sports teams not to have indoor activities. Again, the actual plans here lie with the school districts, and this announcement, the timing of this is very tricky. This comes a day after Kansas City Public Schools hit the pause button on releasing reopening plans. In fact, administrators told me yesterday that they're going back to the drawing board based specifically on rising coronavirus case numbers and this new guidance you just heard. Many other smaller districts are watching, as are we. Rest assured, we'll continue our coverage in our later newscast. I'm Cody Holmgren, KMBC 9 News. We now send you back to your regularly scheduled program.